Okay, you guys, we were doing some educational videos for our nursing team, for our surgical tech team, for our anesthesia team, so that they know how we get everything set up. So here, topic, facelifts. Now that we have everything set up and we've done our educational videos, I want you guys, the potential patients, to see what we do and why we do it, okay? So this patient is not a patient. This is one of our nurses who's volunteered. That's why we have our face covered up. Come a little bit closer. I want to show you something here. Okay, so we can do facelifts under sedation, and we can also do it with patients fully asleep. So when we're fully asleep, general anesthesia, we've got a tube in. It's secured inside the mouth in a way that it won't come out, okay? We keep the tube sterile by covering it with this material here. This is the sterile drape. We have things draped in a way where we can see the whole side of the face, well, the whole face, I'm just keeping her covered. All of the hair, all that's prepped in and clean and ready to go for surgery. And we make sure we've got clothes on here, but obviously there's not clothes. And we want to see in the neck all the way down to the collarbones so that we can make sure that we're doing a holistic approach to our shaping of the face with the facelift. All right. Now, a couple of other, like, really behind the scenes sort of safety features. This is really important. We tie the drape underneath here so that we don't trip in the midst of surgery. Little details like that matter. And then here's another thing that's a safety feature. So in order not to have a sore head afterwards, we've got this gel roll here. Okay, so it's like a donut, but we put extra gel rolls, straighter ones, on either side. So if the head were to roll to one side or the other during the operation, we've got it covered. We've got it secured. It's not going to create any tension on the neck tissues. So that's really important. One other thing I want to point out is that we've got the arms nice and secured. Same with the legs. And during the operation, we move them around at regular intervals to help keep those joints moving, decrease joint pain after surgery. And then this is a really important safety feature. We've got the legs being squeezed by these devices called sequential compression devices, SCDs, that you will go home with. This is this patient's pair, and what they're doing is they're squeezing the blood vessels within the legs during the surgery and in a complex way. It's not just the squeezing and pushing blood around, it's that, but it's also what it does to the inside of those blood vessels, and a chemical that's released. It significantly reduces the potential for blood clots during surgery, which are almost unheard of, by the way, during facial surgery like this. So anyway, I thought you guys would love to see that. So that's safety in the setup for a facelift.